Hello, I'd like to talk to you about some problems called hand care. A lot of people have very, very bad skin when it comes to their hands. Their hands are raw, they're tender, they're sore, they bleed, they can't do their work, or if they do their work, their hands get worse. I'd like to help you learn, or at least know some things about what you might do to help your hands and what you might do to avoid. There really is no cure for hand care problems. There's really nothing that will take care of the fissures, the cracks, that once they're gone, that they won't come back again. So this is a lifetime of working to prevent your hands from becoming a disaster. And I do say a disaster because I've had patients who have had problems so badly that they had to retire from work. They were disabled. They couldn't take care of their children. They couldn't do their hobbies. Life became a disaster. I have a small, as I call it, my protocol, or sheet that goes into details. This particular video is made to try to bring to life maybe some of the information that's on this particular hand care sheet. Most people have the problem of bad hands, dishpan hands, hands that are raw, cracked, have usually some problem behind the problem. In other words, there's something they're doing. It might be their personality, it might be stress, it might even be their genetic makeup. Wind, weather, whether it's too hot, too cold, too moist, too dry, can play a role. The situation is one where you need to become a detective and try to figure out what your own personal problem is. I can give you some general information on things that you need to help yourself with, but there are actually other items and situations. First of all, what you expose your hands to becomes a major problem. For example, the simplest and the most common thing that creates problems, as I mentioned before, is washing dishes, but also washing your hands, washing yourself, washing your hair. So, when you get in the shower, instead of using soap, you can use foamy shaving cream to wash with. You squirt it on the washcloth, cleanse all over. If you don't believe me that it won't get your hands clean, raise the hood of your car, put your hands on that dirty, grimy stuff on the engine, rub it in good, and have somebody take foamy shaving cream and a washcloth and wash off this hand, and someone else use whatever you want to. See which one gets cleaner, faster, and better. I think you'll find this wins. Most people tell me it does. When it comes time to wash your hair, if you have bad skin on your hands, you first need to use some Vaseline. You put the Vaseline on your hands, and you can put on some rubber gloves like this. These are bluettes that can be bought at the hardware store. Go to work washing your hair. However, I must say that most people who have bad skin, eczema on their hands, usually have scalp that gives rise to dandruff. So really the smart thing to do is to take some hair conditioner, mix it into your shampoo, put it on your glove and start washing it in, then you can rinse it out. That's very, very easy.
I'd like to show you my thumb. I have this problem of hand eczema, and that's partially where I gained my knowledge on these things that would help you. I intentionally, the last few days, did not use the gloves nor the Vaseline. I intentionally used shampoo, and this gives you an example of how just in a few days' time the shampoo will begin to eat away the skin if you have sensitive skin, which I have. A lot of people don't realize it just takes a few days of going back on what you shouldn't be doing. In other words, transgressing, sinning in this world of dermatology. I'm joking, of course, but nonetheless, a little bit of error, a little bit of forgetfulness, and you can put your skin right back where it started from. So this is why I'm saying this is a constant situation, a constant problem, a constant effort to maintain your skin.